Hello everybody and welcome to this lecture. We will talk today about guided treatment planning. Of course, we are working on extensive rehabilitation. We will try to tell you how important is the role of the workshop and the mock-up in order to have a predictable prosthetic approach in order to have a successful result at the end of our work. So let me start with the case examination. The case examination starts with the three teams. The patient, that is the most important of the team, the dental team and the lab team. And of course, our effort is that to create a good diagnosis in order to have then the treatment plan that is made in a perfect way, having the chance to follow and to achieve the main goals, and also explaining what kind of modalities you can have it in order to achieve this kind of a result. So it's very important to start with the kind of preview if you can. Of course, today we can use the computer a lot, or you can also use some other way like the mock-up when you have to add volume, for example. Of course, that is a perfect situation in which you can use mock-up that can be direct or indirect. Once you are able to understand your case, once you have catch the case in some way, you can start it to have the chance to explain to our patient what are the possibilities of even of every kind of therapy that you can also propose to him or her. So actually we have to understand the risks, the time, that is very important also to explain it. And of course, you can start always to say to the patient, that's the ideal treatment plan. But at the same time, you have also to consider alternatives that are very, very important for many, many patients, of course. You have to understand the ratio between costs and benefits. And of course, you have to explain also the operative sequence. That is very important because many times the patient doesn't understand, doesn't comprehend that you need to really have different appointments, they cannot be done in once, of course. And of course, as I said before, you can use the mock-up and explaining our patient to do different kind of a choice. For example, it can be like 6 anteriors or the entire arch, for example. But once you start to grind the teeth, then you become a kind of potential killer. Why? Because, of course, until you have the mock-up in place, mock-up is a kind of therapy, or a kind of, better to say, choice that you can propose to the patient without touching the teeth. That is the very good aspect of the mock-up. And of course, that is very important because as soon as you start to use the burr and your red maniple or your turbine with the burrs, you start to grind the teeth, you start to create an aggressive treatment anyway. So after decided what to do, after decide to do mock-up, maybe not to cut the teeth at the moment, you can have also the chance to try to explain the patient exactly what you would like to give to him or to her. And at the same time, you have to be very clear that once you have finished your work, you cannot believe that your case is ended 100% because you have to maintain the case over time. And that is one of the most important steps that is not so well maybe reinforced as a concept many times. It's very important to have a great result at delivery, but it's even more important to maintain these kind of results over time after 10, 15, 20 years in service. So the prognosis is really an important step. And once the patient agree with your kind of thought, with your kind of road that you want to follow in your therapy, at this point, they have to sign the informed consent and having the chance to go ahead for the procedural phase. That's an important step either that you have to really follow. So starting to think about it, think about what you have to offer to our patient. The thinking process is very important. Knowing that most of the time, when the patient comes to you, comes for aesthetic reason, because they cannot go ahead anymore with this kind of unacceptable result, aesthetically speaking. But you have to explain them that all the time aesthetic should be combined with function. It's never alone. Aesthetics is never alone. Function is never alone either. So they have to join together to have the good result at the end. So when you have in front of you a compromised dentition, in one word, you should start to have a good diagnosis and then the treatment plan sequence and exactly explain the patient all the steps on the clinical procedure. That is very, very important to let them understand exactly what you plan for him. So let me do a kind of summary about it. So we have in front of you an extensive rehabilitation case. Where we start, what we do, the starting point. Of course, we never start to grind teeth as starting point. Never, never, never. You have to start with the thinking process, as I said already. It means what? It means that you have to start to analyze all the aesthetic parameters and all the functional parameters, one by one, in order to really have the chance not to forget any kind of detail. Very important. Secondly, we go ahead and we ask our dental technician to do a wax-up. Wax-up is a kind of treatment plan in pectore, as you said in Latin. It means is a kind of solution that gives to you the chance to say that is what you would like to achieve as final result, is what is ideal for you to achieve as final result. So the communication with the technicians for the wax-up is essential, is absolutely fundamental. It means that the technician is never a kind of magician. The technician is a great artist maybe, but at the same time is somebody that needs to receive from our dentist many information, how to change the initial situation of the case that we are treated, and of course how to change it from the beginning to the end. So this wax-up represents the end of your work already. And of course, it would be ideal to show this before doing any kind of grinding procedure on the teeth. If you have to add volume, like today is possible to see in many, many cases on wall dentition, you can add volume. You can do the mock-up at this point. That is a reversible solution. Reversible means that you have not touched any teeth underneath. You just cover with the mock-up the entire structure, tooth structure underneath, and you have created a new kind of solution for the patient. Sometimes it's possible to be done without touching the teeth at all. And that is really a kind of real preview. Also on computer is nice, but this is real, 100%, is what you show to the patient in their mouth. So the mock-up is at this point a very important step to be done, mock-up and then provisional. But when you do provisional, of course, you have started already to grind the teeth. So it's a second stage, which of course you can still show to the patient what you want to do it and what they deserve to have it. But at the same time, with the mock-up is even better because it's a preview before starting to work on patient. So it's still reversible 100%. Again, wax-up, mock-up, and provisional are then at this point ready to show to our eyes what happened in terms of aesthetic and functional integration. And also to show to our patient how it works. And of course, if you're satisfied, the patient will be satisfied either at the same time. But it's not enough. Sometimes you have to put implants and removing the teeth. Sometimes you needed to do ortho, to do other stuff, or to do some the surgical crown lengthening procedure. So at this point, you have to wait maybe some time, like a few weeks sometimes, or a few months another time, to really understand and to wait for the soft tissue healing, soft tissue maturation. At this point, you should achieve this result, to have your work done in a proper way that is perfectly integrated from aesthetic, functional, and biological point of view. That is our goal all the time. And once you did this, then after having waited some time, some weeks, few weeks or few months for the soft tissue maturation, you can copy this kind of solution that you have achieved in the patient in the final result, in the final work. And that's, I believe, that is a very important step. So that is a kind of approach that is, of course, exactly what we have tried to teach in these lectures, the entire course of PROS. And of course, after that, you have to play with all ceramic restoration. All ceramic restorations, of course, is something absolutely nice to play with. We know that we like it to play with these old ceramics. We came from a long time ago, we have used metal ceramic work, and then still using maybe some incredible particular case, specific cases, but normally we use 99% of the time all ceramics. Of course, the word of all ceramic is very important. It will be very attractive for everybody. And today, zirconia in one side, and lithium disilicate on the other side are the ones that really are offered to you in order to achieve the best result aesthetically, but also in terms of survival rate over time. Of course, that is valid also for implants, not just for teeth. Of course, you can use this material for veneers, tabletop, onlays, inlays, buccal-occlusal veneers, crowns, bridges, everything. So in one word, the so-called minimal invasive prosthetic procedure technique, in which you try to preserve and not to be aggressive, and to preserve all the enamel as much as possible you can do it. So all these steps will be again explained step by step in the 10 meetings that we have together. Let me start with extensive rehabilitation. Let me start with a guided treatment plan formulation. Of course, our goal is that to communicate with the dental team, orthodontist, implantologist, what we need to do. And of course, this kind of information should be also given to our patient. Not to say that, of course, it will be very important to communicate, as we already anticipated to you, these steps to our dental technician for analog or digital workup. And then, of course, we have to consider that there will be a possible integration with other digital workflow systems that are still possible to achieve. So data collection are needed in order to formulate the appropriate treatment plan formulation. That will be the most important step to be remembered. I personally have started already many years ago to use a kind of aesthetic checklist. That's the final version that I published together with my book, Aesthetic Analysis, in 2004. But I've been using this kind of aesthetic checklist already for many years. Why? Because I wouldn't forget any of these parameters. So all the parameters are catched one by one in order to be able to achieve the best result. At the same time, we have also the second book that came out in 2007, 3 years later, a lab chart. In the lab chart, we have all the aesthetic, all the functional, that is all the aesthetic parameters, all the functional parameters. They are combined together in order to achieve the good result, in order to have the chance to optimize the level of our data that we can really transfer to dental technician. So that is very important, but at the same time, that are together with the two books, the volume 1, the volume 2, that they were then published and translated in 12 different languages, as you could see from these pictures. 204 first volume, 207 second volume. So analog versus digital. Today we go forward, of course. Every day we improve. We know more things about all the digital work. And of course we are more closer now with the digital than before. That is the reason why a couple of years ago, we started to produce this kind of app. It's called Get App, Guided Aesthetic Treatment App, with the iPad, as you could see from here. You can have inside all the data collection in order to formulate, as I said before, all the treatment plan. What the characteristic, what the feature of this kind of app is an easy tool that guides the clinician in the formulation of treatment plan. Actually, you could say that it's very important because you have a communication with the lab, as you said before. We have communication with the patient. We have a communication with the with the other team, with other people of the team, implantologist, orthodontist. And again, with possible integration with the digital workflow system. So very important steps that are to be followed one by one. As you could see from this, we have a red circle on the upper part and a green circle. The red circle is the data collection. All the green one is the data processing. So you can stop in the middle after the red circle and wait it for having the chance to elaborate all the treatment plan that you express on the green circle that you have seen. So data collection starts with a picture. And the picture, as you can see here, we have two levels that guides you all the time. You can see level here, vertical and horizontal, also in this one. And you have also some mask. As you could see, this mask, the red spotted the line. And actually, in this way, you can have the chance to really, once you have decided, once you have already set the natural head position, to maintain the same position all the time, and to have the set up the pictures in the proper way. Together with the picture, we also use videos, movies. Why? Because the picture, even though are very important, still they are a static moment of a dynamic action. So that is very good limitation. So if you look at these kind of movies here, you can see the full smile, the S sound, the F sound. All the videos are presented here. So you can have the chance to really see the patient moving the lips, moving the mandible, expressing her smile, etc., etc. So that is much more vital than just giving the picture. That's just some example of what you can do. This example of all the kind of parameter that you can go through, like smile line, labial corridor smile width, interincisal line versus, interincisal line evaluation, the upper, the lower, midline of the face, many others. Now I cannot present you everyone, but just to give you like a sign, you can have the app that already start to guide you 100%. Because all the knowledge that we have as a group, we have achieved, we have put inside the app. And actually it's very interesting, because starting from the first screenshot, when you ask the patient, you are like 20 years old, you are female, or 60 years old, you are man. The final target, the final goal will be different. And the app set up already itself in that kind of goal. Just to give you an example. As you maybe know, incisal edge position is the first step of our prosthetic rehabilitation all the time. And the tooth exposure of the central incisors are exactly the starting point of the incisal edge curvature. So let me explain to you. Once you say Paolo Rossi, and is actually a man, and is 60 years old, he can show at rest normally as average 0.5. At the same time, a woman at 20 years old can maybe show 3.5. So different in that kind of value. And starting from that, you can understand that immediately the app gives to you the chance to set up the app exactly with this goal, to achieve this result, that is individual result, specific one, for each one of your patient, not for everybody. It's not generic one, it's really customized. And then you have other kind of instruction. I cannot go through this completely 100%, but just to give you an idea, like give you an example. This was the initial situation. Length was 7 mm.9, 8 mm. The exposure at rest was -1, so you could not see the teeth at all. And the incisal edge was 1 mm down to the upper lip. And the width was 8.7. So the ratio was 109%. It means the width was 109% and the length. But that normally the opposite. It means the width is 80% of the length. So the app knows that and automatically gives to you this chance to give to you the final numbers. And you can see that is exactly or not, because it's red instead of but it is green on the right side instead of red. So you can understand that you are really into position to really replicate this kind of work. So because that is perfectly. Now we have 1.8 of a tooth exposure at rest and 10.7 in terms of incisal length of the upper incisor. So in this way you can have the chance to move the teeth more out, more in, to lengthen, to shorten, and to be guided again by the app itself that guides you 100%. So you can find at the end the kind of final result, the final data. Of course, you can still work on it it means you can still modify as you like it. And as I said before, it's not just an aesthetic parameter that's counted, but also the functional one. Let me show you. That is 9.1 step, and is a kind of rendering. Why nice? Because we have obtained already all green number. Great, but if you want to still customize, look, press there, and then go to the upper, look, now, lengthening. And now all the value around it, they are changing. Also the length changes, shortening, and all the value here are changing automatically. But you can have a kind of preview or real view of what could happen. As you can see, go more out, more in. You can change it, all the numbers change. In this case, it didn't change at all because it was perfect. Then you have the red button there, and you have a kind of a screenshot. In every screenshot, you have a kind of explanation, like an e-book, an explanation of all the steps. It's very, very useful because if you're not so well prepared to this argument, to this topic, you can have it. That is a question mark, how to work with your finger in English. That's in English language. So, at this point, also with the video, you have to increase the video, for example, you can preview at this level here, that you can have the increase of the length of the lower. Look, now it's lengthening, and again, can arrive up to the lingual part of the upper teeth, or maybe better to stop because you are still green, but then become red. So you can thicken it. Look, you can have the chance to have this kind of situation here. Palatal thickening, and now with the palatal thickening, now you have the contact. So you can decide, looking at this kind of rendering, how much increase the lower, how much to increase the upper, in terms of length of the lower and lingual concavity, palatal concavity of the upper in the anteriors. And that's what you can achieve it. And again, the red button showing all these kind of topics. Good. So again, if you're interested to see it, go to Apple Store. Fradiani or Fradiani Education Get Up. Better to say Fradiani, you can find it. Now you push a red button. With the PDF, you send, maybe for the first time in your life, you can have the chance to give to a dental technician or to other dentists, to other colleagues, all the data that you have collected together. So it's great. At this point, you can go ahead with analog way or fully digital, because of course you have all the value that you have achieved in the middle here, how much to increase it, to put more out, more in, so you can have the WhatsApp digitally done, or in the different way. You can have the Facebook taken in the regular way, as you could see here, or having the chance to do digitally again. So regarding the Facebook, in the traditional way, I would like to stress one point, because many times I could see some miscommunication. And I would like to say that normal way should be what you see here. This is an ideal situation. It means that you have an horizontal incisal plane that is parallel to the horizon. That's the horizontal incisal plane here, okay? Is parallel to the horizon 100%. At the same time, eyes of iliac line, they are parallel to the horizon